Hi John, welcome to the clinic. My name's Mark and I'm a sexual health nurse.
Hi Mark.
Can I just first of all just check your birthday please?
Yeah, the 7th of July 1984.
Fabulous, thanks for that. Just needed to make sure we had the right person today, and just because we don't want to talk about the wrong person because I just waste your time too.
Yeah, sure.
So you've come in today for some sexual health screening, I believe?
Yeah, that's right. Just want to get my STI check.
Fabulous. Has anything in particular happened that you're worried about, or just general routine testing today?
Nothing in particular, but it's been a while, so.
So you have had some testing before by the signs of things?
About 9 months ago, I would have
Okay.
had my last STI check.
Yeah. And did you get that done at just another clinic or your GP?
Yeah, through my GP.
Fabulous. Now, what we're going to chat about today, we're going to do a little bit of sort of just quickly general health stuff, and then we'll bring everything around a bit more to the sexual health side of things.
Okay.
There may be some questions that I ask you today that may feel a little bit uncomfortable, but if you do feel comfortable enough to answer them for me today, it helps me understand your risks, and then helps me give you advice and information and do the tests based on that.
Yeah,
okay?
cool.
But please just let me know if you're uncomfortable with anything.
No worries.
We don't always have to proceed. Okay?
Sure.
Now, you've identified your gender on our system as male, is that correct?
Yeah, male.
Fabulous. So when you were born, you were assigned male at birth?
I was, yeah.
Fabulous. So the reason we ask that question is just because we do see some trans and gender diverse clients, and often their gender expression, gender identity don't match the sex they were assigned at birth. So it's nice for us to check so that we can be as respectful as possible. So you last had your screen about 9 months ago. So we'll just do some routine testing today,
Cool.
But we'll ask a few questions first, all right? But just generally, any new medical conditions that we need to worry about?
No?
No?
Fitting well?
Fabulous. Any regular medicines that you're taking?
No.
No? And any allergies to any medicines that you're aware of?
Not that I'm aware
No?
of.
Fabulous. That's good. If we do ever need to treat an STI, it helps if we know if you're allergic to anything, because we don't want to cause you any harm.
Yeah,
All right?
of course.
So have you had any vaccinations, either as a child or as an adult?
I had all my regular vaccinations and travel as well.
Fabulous. So do you think probably for Hep A and Hep B, that hepatitis A and hepatitis B, that you've been vaccinated?
Oh, I wouldn't be sure,
Not
no.
100%?
How would I know?
Well, we can check on a blood test today just to
Okay.
make sure. The reason we like to be sure is for people having sex, there are some STIs and things that are preventable by vaccination. So we'll check for hepatitis A and hepatitis B today. Okay.
Okay.
Now, when you have sex, do you have sex with men, women, trans or gender diverse people?
Men.
Men. For hepatitis A, when you have sex with men, do you ever perform what's known as rimming? Do you know what rimming is?
No, what's that?
No. So when you lick somebody else's rectum or they lick yours.
Oh, yeah. Okay, yeah.
So that's rimming. So rimming puts you at risk of hepatitis A. So we like people who men who have sex with men to basically have vaccination to prevent hepatitis A.
Oh, okay.
Alright?
Yeah, well, we'll need to get that checked, yes.
Fabulous.
Yeah.
If you need to get it done, potentially you can get it here or at another clinic.
Yeah,
We'll give you the
okay.
information based on sort of your needs. Hepatitis B, that's very good because it can be transmitted through anal sex, but also through vaginal sex if you have sex with somebody with a vagina. So we'll let you know if you need any vaccinations for that one as well. Have you had any tattoos or piercings?
One, yes.
One tattoo or
Yeah,
piercing?
tattoo.
Tattoo?
Yeah, on my
Fabulous.
leg.
Was it done in Australia in a proper tattoo sort of parlour?
Yeah, it would have been.
Fabulous.
Yeah.
And you've seen all the equipment came out nice and clean and sterile?
Yeah.
Perfect. Look, if you ever
notch.
do get a tattoo that's not done in an official sort of premises, just make sure it is still though with sterile equipment, okay?
Oh, right.
Because that puts you at risk of hepatitis B and hepatitis C. Hepatitis C, unfortunately, we cannot vaccinate for, but the good thing is now we actually have some really good treatments where we can cure Hep C in up to 95% of cases. Okay.
Oh, okay.
Have you ever injected any drugs into your body, either recreational or steroids or anything like that?
No.
So if you ever do inject anything into your body, it does put you at risk of hepatitis C, especially if you share equipment with other people. So if you ever do inject anything, make sure you've got clean equipment. And there's a lot of sexual health services that are also needle exchange programs. So you
Okay.
can always get clean equipment for free from them. Okay,
Yeah,
and there's
cool.
lots of them around the community as well. So they're really good ways to protect yourself from hepatitis C. Alrighty.
Yeah, I'll avoid that.
Yeah. So we'll probably head on to the kind of sexual health stuff now at the moment.
Yeah, cool.
So I'm just going to double check. There's no symptoms today. So what we generally look for is lumps, bumps, rashes, abnormal discharge, soreness, swelling, bleeding from bum or penis.
No symptoms.
Fabulous. And testicles don't feel sore or swollen today.
No,
Everything
all
feels
clear.
normal.
Yep.
Perfect. So look, if you ever do have symptoms, definitely come either in and see us or see your GP, because that might be indicative of an STI or a sexually transmitted infection. But that doesn't necessarily mean that if you don't have symptoms, you don't have something, okay? Because most STIs are tricky and don't show any symptoms, okay?
Yeah.
So that's why we like regular testing, even if you don't have symptoms. So we call it screening, because you're looking even when you don't think there's maybe anything there, okay?
Yeah.
So gonorrhea, chlamydia, syphilis, those are the 3 bacteria you might come into contact with during sex. They can all be cured. HIV is a virus that you might come into contact with. Unfortunately, not curable at the moment, but if somebody is living with HIV, we can actually get them on very good treatment and they'll live a long, normal, healthy life. I'll get into that a little bit more in a few minutes. So when you have sex, are you generally the insertive partner or the receptive partner?
Both. Yeah.
Both?
Yeah.
So a bit versatile then?
Yeah, absolutely.
Fabulous. Now, what would you say your condom use is in general?
Oh, not as good as it should be.
Okay.
Probably about a quarter of my sexual encounters.
Okay.
Maybe. Yeah,
Cool.
25%.
Look, while we are health professionals and we're trying to prevent STIs, we understand that we're humans. Okay?
Yeah.
We're not always going to get it right.
It's
okay?
not always easy.
Exactly.
Yeah,
You
kills
might
the
have,
mood.
well,
doesn't it?
exactly. You might have had a bit too much to drink. You might just play and forget. You might not have a condom handy.
Yeah.
You know? And that's fine.
What's a good way to sort of bring it up?
Yeah, look, it's not always easy to bring up because, you can sometimes feel that it might kill the mood. Look, if you're arranging a hookup on one of the apps like Grindr or Scruff or something along those lines, then often you get the opportunity to put on your profile whether you are on PrEP, whether you use condoms, whether, you've got what sort of, when you were last tested, all these kinds of things. So that sometimes takes that sort of trouble out of doing it. But what I sometimes say to people is, look, an easy way to do it is to offer up your story first so that somebody isn't feeling attacked by you saying, when was your last test? Okay. So you just say, okay, I had a test 2 weeks ago. I was STI free and HIV negative. When was your last test? So you're placing your trust in them and they'll feel that and maybe feel a bit more comfortable kind of reciprocating and letting
that's
you know.
nice. That's a good way to do it.
Yeah, it means then they'll feel a little less sort of attacked sometimes and may feel a bit more comfortable. But generally, because the problem is sometimes people are like, oh yeah, I'm HIV negative. But when you ask them when their last test was, it can sometimes be more than 2 years, more than 3 years, sometimes even more than 10 years, okay?
Really? Yeah.
So like a lot can happen in that space of time. Like they may not have had any sex in that 10 years, but they may have. So you can always say, look, it's been a little while since your last test. Have you been sexually active, They could say, maybe just oral sex. So oral sex is extremely low risk for HIV, but it's more risk for gonorrhea, chlamydia, syphilis. But we can cure those. So, if you're not using condoms for oral anyway, you can still get gonorrhea, chlamydia, and syphilis. All right? So the way we sort of really kind of think preventing HIV, one of the really good methods we now have is PrEP. Have you ever heard of that before?
No.
No? So PrEP is a medication, and it stands for pre-exposure prophylaxis. So the medication itself is not called that, but it's just a nice little term that we use. And basically what it means is you're taking it before exposure. So if you start taking PrEP, you would maybe sort of take it for a full week, and then you could start having sex without a condom and be reassured that in up to 98% of cases, HIV would be prevented.
Oh, nice. Okay.
But you need to be taking it every day for that 98% cover. So basically the medication that is PrEP is actually a medication that we use to control HIV in somebody who's living with HIV. But when somebody who is HIV negative takes it, it's a good preventative. So we'll give you some information today on how to access PrEP. The good thing is if you have Medicare in Australia, it's very easy. It's not impossible without Medicare, but it just is a little bit more difficult. All right. So we'll give you the information to take away, and I would encourage you to definitely look into that and get that ball rolling nice and quick.
Yeah.
Okay.
So
when was the most recent time you actually had sex?
4 days ago.
4 days ago?
Yeah.
Was there any anal sex involved at that point?
Yeah, both.
Yeah?
Yep.
Yeah, so top and bottom?
Sorry, yeah, that's
receptive?
right.
Yeah,
Insertive and
fabulous.
receptive, yeah.
So did you use a condom in those cases?
No.
No? Cool. Like I said, you're human, don't worry.
Yeah.
There's nothing we can do in the past, but we can sort of help you for the future. Now, you said it was about 4 days ago, is that right?
Yes.
Yeah. So unfortunately, you're past the window period for what's known as PEP. So PEP and PrEP are very similar, but they're taken slightly differently. So while PrEP is pre-exposure, PEP is post-exposure. So you can start it after the fact.
Right.
And help prevent HIV. But there's a window, okay? We need to get it into your body before 72 hours have passed, okay? So we just missed that, but don't worry, okay? Doesn't necessarily mean that HIV is a 100% conclusion for you, okay? It just means you've kind of got a moderate to high chance. So when you're having sex, being the insertive partner still is a risk for HIV, but it's not as high as being the receptive partner. And if somebody ejaculates or comes inside you, that rockets your risk a little bit higher. So these are things that kind of play in your mind as to what risks you kind of want to take while you're having sex. But if you're on PrEP, that lowers your risk overall by up to 98%. Okay? So in the case in the future, if you're on PrEP, you're going to be reducing your risk.
Right.
Okay?
Get onto
But
it.
what we're going to need to do in this case, we'll test for HIV today, and that'll cover the period of 6 weeks ago and earlier, because HIV takes about 6 weeks to show up on a blood test. All right. So what we'll do is we'll get you to come back in, either to us or to another clinic, and just repeat the HIV blood test after 6 weeks have passed.
I see.
And if you're negative at that point, it's 100%. And then you could probably be in the perfect position to then start PrEP.
Yeah, absolutely.
Okay? So I would recommend using condoms a little bit more diligently up until you've got that close of window period, just in case. 1, for your own health, and 2, for protecting other people, just in case HIV is in the mix.
Yeah.
All right?
Yeah.
Does that make sense?
Yeah, perfectly.
Yeah? So with HIV, we know there's a risk there. So that bit, we'll put that bit to the side just for now, and we'll talk a bit about the other sort of STIs.
Yeah.
Okay, so like I've mentioned, gonorrhea, chlamydia, and syphilis, they're your bacterial STIs, and they often have no symptoms. So that's why we like you to test at least every 3 months, but depending on how many partners you have, you might want to extend it and not come in every 3 months, but maybe 6 months or every year. I'll let you work that out yourself, okay? If you do start on PrEP, you'll get screened every 3 months as part of your script process. So the recommendations for your doctor is to screen you for all STIs every time they give you a PrEP script. So if you do get PrEP, you'll be getting screened probably more regularly.
Yeah,
okay?
great. All
So
right.
that's a really good way, okay? Because then exactly, because it means we'll find STIs a bit quicker, we'll treat them a bit quicker, and then that stops them spreading in the community as well.
Yeah.
Okay? One ever tells you that they've been tested positive for something after you've had sex with them, come in and see us or see any sort of sexual health clinic or GP and get tested straight away. If it's syphilis, you'll want to get treated and tested at the same time, because syphilis is a little tricky. It's the same as HIV, it takes 6 weeks to show up on the blood test. So we could sort of say, for example, you had sex 4 days ago, and then they told you they had syphilis. You then got tested today, it wouldn't show up on the blood test. So you then might go out and have sex with 3 other people and potentially pass it to them. And if they had sex with another 3 people each, that's another 9 people. So we like to, as soon as you come in, if you have been in contact with syphilis, we'll test you and we'll treat you just so we can make sure we stop the bacteria right there. So just bear that in mind. If anyone ever tells you that they've been tested positive for gonorrhea, chlamydia, syphilis, go straight to your clinic, get a test, and we'll advise whether we need to treat you.
Yeah.
Does that make sense?
Yeah, perfectly. Great.
So the tricky thing is gonorrhea, chlamydia, syphilis are all very well transmitted through oral sex as well. So even if you were to use a condom for anal sex, most people don't use them for oral. Good thing is to routinely test. Okay, so if you do decide that PrEP's not for you, just maybe every 3 months testing would be a good idea. All right. And again, symptoms, you generally don't get symptoms in the throat. So if gonorrhea or chlamydia is in the throat, you probably aren't going to know about it.
Yeah,
all right. So what we're going to do test-wise today, we're going to do a throat swab for gonorrhea and chlamydia. We're going to do a urine test for gonorrhea, chlamydia, and we'll get you to do your own rectal swab for gonorrhea, chlamydia. Okay, so we don't need to do the swab in your bum for you because you don't have any symptoms. Okay,
Yeah.
if you ever did have any symptoms in your bum, you would see a doctor and they would potentially do the swabs for you. But you're capable. We'll let you do those privately.
No
A
problems.
little bit less embarrassing for you.
Yeah.
Okay. So before I send you off to do your swabs and urine, we're going to do your blood test, okay? So just before we do the blood test for HIV and syphilis, because they're both on blood tests, we just need to make sure that you're happy and consenting to the test today, understanding what potential results might come back, and understanding, you know, the results process.
Sure, yeah, no, happy to go ahead.
You're happy to go
Keen
ahead,
to.
and you don't have any issues with blood tests like fainting or dizziness?
Don't like them, but other than that, no, all good.
Fabulous. I can work with not liking.
Yeah.
It's more I don't want you to land on the ground.
Okay.
Was there any sort of other questions that have cropped up for you? Anything that you're worried about or any concerns at the moment?
No, it sounds like a pretty clear plan, just to get those tests done and get on the prep.
Yeah.
Yeah.
Prep's one of those nice new sort of things that's come out of research and practice. Another new really good thing, and I sort of touched on it a little bit earlier with HIV. Have you ever heard the term undetectable equals untransmissible before?
No.
No? So I mentioned about HIV being a chronic manageable condition, okay? So people living with HIV now, when they know they have the virus in their body, they can start taking a tablet a day, potentially, and then what that tablet does is it basically suppresses the virus. Unfortunately, it's still in the body, but it's not causing as much havoc as it used to. When somebody has their meds taken every day, every sort of 6 months or so, they'll have a blood test to check how much virus is in their blood. And for the majority of people, they'll be what is known as undetectable, which means we can't pick it up on a test. When somebody has that status for 6 months or more, all that means is you could have sex with a person who's undetectable and not get the virus from them. And that's 100%. So somebody who is living with HIV has an undetectable viral load cannot pass the virus on through sex.
Wow, okay,
All
that's
right?
reassuring. Yeah.
So if you ever have that sort of pre-sex conversation and someone says, oh, Paul's undetectable, or I'm living with HIV, I'm undetectable, that's really good, okay?
Yeah,
And
all
generally
clear.
that's something pretty trustworthy.
Okay.
Because, you know, they trust, and it's a new big thing for them that they can know with 100% certainty they're not going to pass HIV along. Anything else that I can help you with today?
No,
or?
that sounds great. I'll do the tests and I'll make the appointment for the script.
Fabulous. And you can either repeat your 6-week close of window period test with us, or you might want to do that with your prep doctor, whatever works for you.
Yeah, great. All right.
All right.
I'll follow
Thanks
up
very
on that in
much.
6
Nice
weeks.
to meet you.
Nice to meet you, Mark.
All right. Thank
Thanks.
you.